All right.
Okay, Lillian, we'll see you. Thank you.
Thank you, Monty.
Take care.
All right, 8:13. We have Reverend Tax Director Daphne Shimizu coming up in minutes, but as always, long weekend, tragic weekend. I don't want to lose sight of how this weekend, I mean, we had the easing of restrictions, and then it was like, boom, with the deaths and the high number of positives over the weekend. So very, very concerning, and I know we spent a lot of the show talking about essential, non-essential, but I never want to lose track of the virus, which is why we're all sitting here gathered around Facebook Live and the radio. So, Lillian, if we could just start with, maybe we'll start with the COVID census at Guam Memorial Hospital on this Monday morning.
Sure. Good morning. Good morning, Guam. Our COVID census this morning is at 27. It's coming down, but we're still, again, anticipating, particularly with the high numbers of the recent positive results. And so, we expect that perhaps 20% of them may need to be in the hospital. Hopefully not, but, we just have to plan for it. And of the 27, 9 of them are still at the level of care of ICU. And of the 9, seven of them are on ventilator support. And so, yes, we lost several of our patients over the weekend. Started with Thursday, we had 1 fatality, then 2 on Friday, and then 2 on Saturday. So, within a matter of 3 days, that's a total of 5 individuals we lost, which is really sad. So our condolences and our thoughts and our prayers to the family for their loss of their loved ones. We had several discharges to home and to the ISOFAC. So there is hope there that people are recovering and are healing.
Well, Lillian, can you just, so we had 4 the deaths, could you just go through them each and provide any additional detail that's available?
Their ages range from 45 to 83 I'm looking at the 5 individuals starting from Thursday evening. And so, they all had multiple comorbidities, underlying health conditions. And so primarily it's really their respiratory system that was just so compromised by this COVID. And so it just exacerbated their underlying health conditions.
I did see, though, there was one patient, I believe he's a 45-year-old man,
Right,
transferred to GMH, and there was no indication on there that he had any comorbidities.
Right. And actually, Lillian, I'd reached
It
out
was
to
a
the...
53-year-old male individual who was transferred from GRMC. Yes, he had some underlying health conditions.
Oh, he did?
Yes.
Okay, I was talking with the family, and they said that he didn't, and he was 45 years young, is what they had told me, as a customs officer.
The young man, yeah. Okay. There is that individual who was 45 years old.
Right.
Yes.
I mean, this is just so sad that so many people are dying that Lillian's got to sort through paperwork I mean, it's really alarming, guys, and I don't want to lose track of this.
It is alarming.
Yeah.
It really is, and it is sad. And yes, we're just, our condolences and our prayers to the families. And yes, that male individual was transferred. There is that 45-year-old male individual who was transferred from GRMC.
But
He
just
does have an underlying condition with his kidneys.
Oh, he did. Okay.
At least that's what we have on file.
Right. Okay.
And so just, I'm not sure if you have anything else, but I did just wanted to ask Lillian, if in the event that we don't get you on later this week, if there was any message that you had to the DOD team that's preparing, I believe, to depart on the 30th.
Right. Well, we requested for an extension, and we were granted. As of Saturday, we were informed that 9 of them will stay back. 9 of the CCRNs and 1 physician who is an intensivist will stay back until the 4th of October. And that's to help us with the safe and smooth transition because we now have the New West Staffing Solution staff on board, and so they're getting oriented and they're getting acclimated to the organization, the policy, where the supplies are, especially the crash cart, so that they're prepared whenever there's a code blue. And it primarily really the remaining, the 9 remaining DOD CCRNs and intensivists, their focus is primarily just to take care of the patients. And we, as GMH staff, will make sure that we orient and we train and we acclimate the newest staff. So they will be the ones, the DOD nurses will be the ones focusing on the patient care, and we then will make sure that the New West staff are getting acclimated, oriented, and trained with the policies and the EHR system and where supplies are, particularly with the crash cart.
Has there been any final decisions then on how much of the New West staff or the GMH staff will be, detailed over to GRMC?
We have detailed assigned some of our general medical surgical nurses. 12 of them in total we assigned, but then there were some issues with regards to, the nurses have gotten sick, and so they haven't been able to work at GRMC. But we have given GRMC some of our medical surgical nursing staff, and absolutely we are going to consider and see how we can help with the ICU level, because we still continue to receive non-COVID ICU patients in our emergency room. In fact, we have 3 right now in-house who are non-COVID ICU, and 2 of them are on ventilator support. So, we still need to be prepared and plan that we will continue to receive non-COVID patients, either at the ICU level of care, telemetry, or even medical surgical.
Is that a change, Lillian? Because I remember, was it last week you guys weren't taking in non-ICU or non-COVID ICU patients?
That's the plan, so that we can then accommodate all COVID patients. But, people still come to GMH, because we're the closest probably that they need emergency care. And so when they come into the emergency room and they're determined that they need to be on ICU level, then, we take care of them. And we stabilize them. And once GRMC is able to receive the transfer, then we coordinate all of that. But, that's been the plan, is to make this facility strictly COVID. Unfortunately, people still come into the emergency room, and so we still have to take care of them.
Lillian, can you kind of sort through when we talk about the hospitalization numbers? Obviously, they've been on a steady decline, but how much of that is because we're losing people, and how much is it because of people getting discharged?
Sure, that contributes to the decline, but at the same time too, as I said earlier, we've discharged people home to their home. They recovered, and so they're discharged home, and also to the ISOFAC if their home is not adequate to keep them isolated in a room, so they go to the isolation facility. So that, part of that, but we, like Friday or Saturday, we saw 9 individuals in the emergency room who are COVID positive. So some of them got admitted, some of them were released home, discharged home. But it's an ongoing process that, we discharge, we lose some, but then we also continue to admit.
Do you know anything about the 68 positives that were reported over the weekend, Lillian? We put in the ask to Public Health, and we're awaiting any info, but I mean, you said 9. You guys had 9 positive on Saturday.
Right, but then we don't know if those came from the 68 or from the previous, earlier results when they tested positive, and maybe they weren't manifesting symptoms or severe enough to warrant to come into the emergency room. So, you may test positive today and you're feeling fine. 2-3 days later, you may start having, the symptoms of shortness of breath and not getting enough oxygen into your system. So that can happen. So, of the 68 that tested positive over the weekend, we may see some of them come into the hospital this week.
Right. Lillian, I guess in closing, you've always had a strong message for people. It's now we've kind of flicked the open switch on in so many parts of our economy and our, community. What's your message to the people of Guam this morning?
please continue to wear your mask. Please continue to try and keep yourself distant from others. Maintain that social distance as much as possible. And, again, wash your hands. Because this is going to be the lifestyle we're going to be living now. And we just need to continue exercising those infection prevention measures. That's our lifestyle: is to wear a mask, keep distance, keep yourself distance from others, and wash your hands.
All right.
Thank you,
Thanks,
Lillian.
Thank you too. Take care.
Yes,
Stay
thank-
safe.
Okay. 8:23. We'll keep it in the KUAM News Zoom room. Daphne, we're gonna give it a second. Our sanitizing duendes are gonna wipe everything down for you. Don't touch anything. Hands up.